oils do you gravitate towards? What do you like to grab to kind of change your mood, kind of give you a little boost in your step to kind of keep you going for what you need to do? I am curious to know. Let's see. So Christy, cheer, hope, and console. I like that. Adaptive, like that. Malama and adaptive. Shinrin Yoku. Oh, this is cool, guys. Adaptive capsule and neroli. I like that. Green mandarin and neroli. Very cool. Copaiba, serenity or adaptive. Bergamo. Adaptive balance, Copaiba, serenity. Balance and wild orange, frankincense, adaptive and lavender. Oh, I love it. I love it. Citrus bliss. I love it. And here's what I love most. There's not a wrong answer, right? There are so many essential oils that you can grab for in different times of need, for different things, but they really do have an impact on us. They really have that ability to change how we feel. And I feel that what really influences that choice is a lot of times personal preference, what we're familiar with, and what we have on hand. Okay. So what I used right now was I had adaptive rollerball. So I just put that on my pulse points on my neck. I like to put it around my temples, and I just put a little bit on my hand, inhale for a little bit, and rub it on my neck. That's how I like to oil up when I'm needing a little pick me up. Awesome. Thank you for sharing, guys. Oh, and then citrus oil, vanilla bean balance, Shinrin Yoku, jasmine. I love it. Adaptive, through left nostril. Oh, adaptive through the left nostril, closing the right is most effective results. Interesting. I've not tried that before. I'm gonna have to give that a go next time. All right, awesome. So we've just got a couple of announcements. Let me pull up the slides. Hopefully you can see that. Oh, so where are we at? So Doc Talk today, we're going to do that. We've got some resources so you can stay connected. So if you want to stay connected and get reminder emails of what's coming up, go ahead and text OILS CE, OILS CE to 605-432-8639. And then as always, we've got the recording and resources and more available in that Heights platform. You can either use that QR code or use the bit.ly/whole education. And we've got new things in there. We've got the toolkit for rosemary, tea tree, vanilla chai, and harvest spice is now available. A big thanks to Melody and Ruth for getting that set up. Upcoming. Oh, did I just lose it? I don't know if I just lost it. Hang on. Upcoming, we have Hormone Health for Men and Women on Monday, August 25th at 7 p.m. And then on August 26th, the following day, we've got Natural Solutions for a Healthier, Happier You, which is going to be kind of like just a general education class on how you can use the natural solutions to really start kickstarting your health and wellness. All right, so next week, Monday and Tuesday at 7 p.m. both nights, Central Time, we've got those classes going on. You've got the Zoom meeting ID there and the passcodes for the different classes, and I'm sure there'll be a reminder. All righty, and that, oh dear, that is it. If I can figure out what I just did. There we go. All right. So those are the announcements. Now let's get to some questions. All right. So first one, oh, and let me get your chat up just to make sure I've got. Okay, perfect. All right. Sorry, guys. Ruth is so much better at this than I am. Okay, so first question. A safe and healthy way to stop Humira for psoriasis and a statin for HDL, LDL imbalance. Thank you for all that you do for us. Okay, so Humira is a biologic used to treat a lot of inflammatory issues like arthritis, psoriasis. Um, what I knowing what the mechanism of action for Humira is really helpful. In this case, Humira actually works on the TNF alpha pathway, the tumor necrosis factor pathway, which is responsible for a lot of inflammation within the body. What's cool about knowing that is, if you remember when the frankincense duo capsule was released, so that's the frankincense essential oil with the boswellic acid. They had a slide which showed all of the inflammatory pathways which is able to have an impact on, and tumor necrosis factor is one of them. Okay, so if you have an anti-inflammatory issue like psoriasis, you're taking something like Humira and you want to get off it, what I recommend is I never like to go cold turkey. So I kind of like to taper it down. So you can do that in a few ways. A lot of times if it comes in a capsule, it's hard to break it up. So if you're taking it twice a day, I would kind of go down, instead of twice a day every day, I would do twice a day, then once a day, twice a day, once a day, and do that for a week. Then just do once a day for a week, then every other day for a week, and then just kind of like start knocking it off like that way. And hopefully that way it will allow your body to adjust as you come off of just about any medication. That's kind of like an easy way to do it. It is always advisable to talk to your provider before you do that, because sometimes there's really good reasons for people to be on medication, and so if that need is still present, we don't want them to just stop taking medication. Okay, so it's always good to talk to your provider. Knowing, in this case with Humira for psoriasis, knowing that the frankincense duo cap also works on that same inflammatory pathway, I would highly recommend start taking that as well. So take them both at the same time and then just start to taper off the Humira. And if needed, you can kind of increase the frankincense duo cap. So how would I take the frankincense duo cap if I had something like psoriasis and I needed that extra support? I would take, obviously depending on how bad it is. If it's fairly aggressive, I would probably take it 2 to 3 times a day. You're not going to overdose on frankincense, which is really nice. So if you were to take it twice a day, that's kind of like my go-to dosing in the morning and in the evening. It's easy to remember. If you need more, you have some options. Okay, option 1, you can take 2 in the morning, or 2 in the evening, or 2 in the morning and in the evening. So you're taking 4 capsules total throughout in that 24-hour period. Or if you're really disciplined and you're really on the ball, you could take it multiple times throughout the day. So you could take it in the morning, lunchtime, dinner time, as you go to bed. And the reason we do that, in pharmacology, we look at clearance. So if you think of a graph, you've got concentration in the bloodstream along the bottom, and then you got, time along the bottom, concentration along the top. I mean, on the y-axis. When you first start to take something, there's nothing in the bloodstream, right? So 0 hour, there's nothing, but you take it at 0 hour, then it slowly will start to go up, and you get a fairly quick increase in the absorption. Then a lot of times, depending on the formulation, it's going to drop right back down. Okay, and that rise can vary. Okay, and what's really interesting is that doTERRA has actually been doing a lot of pharmacokinetic research when it comes to essential oils. I know they're working at getting ready to release that information, so hopefully a convention, if not sometime soon. Okay, but that will kind of give us an even better idea on how like an appropriate dosing. So let's say if it's like, I would say a lot of things on average are about 4 hours. There are medications which are quicker, there's medications which are longer, but let's just say 4 hours to keep things super simple. Okay, or 6 hours. Let's do 6. So you get the peak, and over the next couple of hours it starts to come down. We're looking at a therapeutic window. So if we were to take 2 in the morning, or like if we were to take a bigger dose, that peak goes higher and it takes a little longer to come back down. And so we're extending our time in that therapeutic window. And so take two, have a higher peak, slightly longer duration, take another two, goes up again, slightly longer duration. That's a good way to do it. Another way is if you're just taking one, it's not as high, it comes down a little bit quicker, but then you take another one and then it just kind of keeps going. So either way is appropriate. Whatever is easiest for you, you can take, so I would start off with one in the evening, one morning, one evening. And then if you need a little bit extra support, you can either take two or you can take another one at lunchtime. If you need more, you can take another one as you go to bed and just kind of space it out that way. Hopefully that makes sense. Another thing which I really like for psoriasis, because it is an issue with our skin, using a frankincense stick with the Nile wood can be really, really beneficial as well. I don't know if anyone on here has something like psoriasis. I'd be interested to see what you like to use. I think that would be really interesting. So go ahead and let us know, or if you have someone you're working with or a friend who you're helping, what has worked really well. Another thing I like, when the skin is very inflamed and angry, I love using balance. A calming oil like balance for me works really, really well. I used to have eczema. Every now and then I'll have a flare up, depending on a few things. What I found works really well is also rose and blue tansy. Okay, but again, I liked it as you can have a selection of oils. Those like my go-to though would be frankincense and the frankincense stick. For psoriasis, I would also use balance, but there's other things you can use. All right. For statin, for HDL and LDL. So that's when I think about that, I'm looking at metabolism. So what oils or what supplements can we take for metabolism? And when it comes to systemic problems like cholesterol, I really do like internal use of essential oils and supplements. So my favorite ones when it comes to HDL and LDL would probably have to be Zendocrine, complex and soft gel, as well as the MetaPower Advantage. I would highly recommend taking those. It just makes it really, really simple. If you want a single oil to kind of help, I would recommend grapefruit essential oil. And how would I use grapefruit essential oil? I would just put it in my water and I would just drink that a couple times throughout the day. I would definitely do it close to meal times because that's when we're consuming a lot. And remembering as well, cholesterol comes from animal products. All right. If you're eating more plant-based cells don't have cholesterol and they have you're not going to get the LDL cholesterol from plant-based products and food. So if you want to lower it, you can just change your diet to eating more predominantly plant-based foods. If you're going to eat meat, which is absolutely fine, I would just recommend for eating leaner, more pasture-raised, grass-fed, or like healthier sources for your meat. That will definitely have a good impact. Also, omegas are really, really good at helping to regulate cholesterol. So I would definitely be taking the omega supplements. All right. Then we've got have a friend who's asking for help with a 15-year-old niece who has von Willebrand's disease. She does not take supplements or use oils. History: 3 transfusions in the past 5 years, about 1 month ago, usually because her hemoglobin levels were too low. She has very heavy menstrual bleeding that can last weeks to months at a time. Doctors put her on birth control. Anemia has been a constant battle. Do you have advice? So von Willebrand's disease, that's an issue with forming good clots, okay? And so people bleed really easily, and that's why menstrual periods, especially for women, are going to be a lot heavier than normal. And it can be a real issue. And just as this poor individual is experiencing, you lose a lot of blood. How do you replace that? A lot of times you have to transfuse. Okay, so unfortunately, it is a genetic issue. And so what she needs to do is really just focus on feeding and nourishing her body as much as possible. And so the person says, I would assume foundational wellness would be a great help overall for microbiome, cell, and organ function. And absolutely. Okay. So I would definitely be taking the the VMG Plus, I would be taking the Omega Plus to really give my body all the nutrients that it needs to function more optimally. Okay. Also, when we look at clotting factors, a lot of times the omegas can help us to produce good amounts and help to regulate that. So I would definitely recommend that. Oils to support. My go-to when it comes to bleeding issues would be helichrysum. Okay, so if she's, and I'd be interested to see if she's kind of got some heavy cramping, maybe massaging some Claricalm and helichrysum over the lower abdomen. That might be of some benefit. If she's got bleeding elsewhere, because if you bang yourself, you're going to bleed a lot easier. I would definitely be putting helichrysum over there as well. Okay, so I would give that a go. But yeah, you're absolutely right. Foundational wellness is going to be key when it comes to issues like that. In the comments, we've got for eczema, take Terrazyme with every meal. I use frankincense stick and helichrysum roller, and I take Frank capsules morning and night. I add Zendocrine for a week if I had a bad flare and need detox. Love it. Perfect. So yeah, there you go. Frankincense capsules, frankincense stick are really, really good. I do like the additional use of Terrazyme, knowing that a lot of skin conditions are flared up from a bad gut. That really helps to keep things regular and helps you have a healthy gut. And then Zendocrine can be really good. Again, like it is a great thing you can take for short things, short term when it comes to helping to detox. Love it. Thank you for sharing that, Faith. Okay, I've been working with the spouse of a good friend. He was having some serious digestive issues for years. Had a lot of blood work abnormalities, positive Epstein-Barr virus results, showed active viral reactivation, really low testosterone, tested positive for H. pylori. He did a 90-day reset and was taking mastic gum recommended by Dr. Spellman for the entire 90 days. His blood work has massively improved. That's awesome. He feels amazing for the first time in years. But his H. pylori just came back. It's still positive. Do you have recommendations on what to do going forward? He remains on all foundational wellness, Terrazyme plus Advantage, and is now starting phytoestrogen too. Okay, so I was reading, oh boy, what was the book called? It's something like Mission Microbes, but it was from a physician who was talking about how through overly aggressively treating H. pylori, we kind of created a whole different set of problems. So if we were to go back like 20 or so years, H. pylori was linked to ulcers. And so the thought there was, if we're seeing a lot of people who have ulcers have H. pylori, let's eradicate H. pylori, we'll be able to eradicate ulcers. And so they put a lot of people on, I think sometimes it was like a triple antibiotic regimen to completely eliminate H. pylori. And what they found is it didn't necessarily, a lot of times it didn't actually improve symptoms. People still ended up with ulcers and they ended up with some other issues as well, partly because of the damage it was causing to the gut, to the good gut flora. And so first thing I would say is, if he's testing positive for H. pylori, is he still having symptoms of reflux? If he's not having symptoms of reflux, don't worry about it, okay? And the reason I say that is because, as you know, like our bodies are a petri dish. We have got so many different bacteria in different areas of our body. We have like bacteria all throughout our GI tract. So we've got different bacteria in our mouth, different bacteria in our stomach, different bacteria in different areas of our small intestines, large intestines. Some of those bacteria are pathogenic, meaning they can cause problems. But the majority of the bacteria are really beneficial, complementary. They support natural processes within the body. They help us to function better and to feel better. H. pylori is one of these bacteria which can absolutely cause problems, but it's often kept in check. So just because they're testing positive, If he's feeling fine, if he's doing great, if he's not really having a lot of reflux issues, I would say don't worry about it. If he is having issues, then I would say use all the things DigestZen. Okay. And the reason for that is you've got some great essential oils in DigestZen, peppermint, which is going to be antimicrobial. You've got ginger, fennel. All of these are going to be really beneficial at helping to regulate a better microbiome in the stomach. And so that would be something which would be really, really beneficial. Now, all the things DigestZen. So let's just talk about that. You've got DigestZen essential oil. Okay. I like using the oil if I'm getting like more symptoms kind of up in my throat. Okay. If I feel like it's affecting my esophagus, I like taking something which is going to directly interact, like come into contact with that. So I like putting a couple drops of DigestZen oil in some water. I can drink that, and then it's going to physically interact all the way down. Then it can get into the bloodstream and impact that way as well. But I like that you get that instant action. If it's not in the esophagus, then you can put DigestZen in a soft gel. You can take the DigestZen soft gel. Some people really don't like the flavor or the taste of DigestZen, so that's a good option. I do like the taste, so I can anyway. Another good one to use is the DigestZen tabs. Now, what's cool about the tabs is, again, you've got that direct contact as you're chewing it and swallowing it, but it's also got the calcium carbonate, which is going to be good at helping to settle down the pH to help the ulcers to heal as well. And so you can take that frequently throughout the time. Then we've got DigestZen rollable. You can use that as needed. But I would really recommend using DigestZen for that. Okay. If they want to get a little more aggressive, another great way to really support the antimicrobial properties, do a soft gel with oregano and melaleuca. The melaleuca and oregano combo are really, really beneficial. You can other herbaceous essential oils, which are great when it comes to gut health, would be things like rosemary, thyme, fennel. Okay, those would be great essential oils that you could experiment with. Okay. Okay, in the thing in the chat, looks like we've got a good question. What oils can help reduce plaque, increasing the microbiome in my mouth? I'm eliminating sugars and dairy, take VMG plus omegas and PP Restore. I have a great oral hygiene protocol. Just need to get rid of the accumulating the plaque. Yeah, so, and then Faith has kind of already answered it. Zinc can be really good for plaque, and the On Guard chewables have zinc. The reason I love the On Guard chewables is not only does it have the zinc, but it's got the On Guard. On Guard is such a great essential oil that we can use to support the overall microbiome of our mouth. Okay, so using now, I'm going to be honest, I love mint. I'm a mint toothpaste guy. I haven't been a big fan of, like, before we got into doTERRA, I was not a fan of cinnamon. I really like using the On Guard toothpaste, partly because I know that as I'm using that, not only am I getting good sources of hydroxyapatite to help with our strong, healthy teeth, but that On Guard blend that's in the toothpaste is really good at protecting the oral mucosa and, like, just as a whole helping support our mouth. You get that same benefit when you're using a mouthwash with the On Guard chewables. So I would definitely recommend On Guard toothpaste, On Guard mouthwash, On Guard chewables. Those are going to be great things to add. And also, do they have On Guard gum? I can't remember. I don't think there is On Guard gum. There's MetaPower gum, but chewing gum after you eat is also a really good way to produce saliva to help break down and protect the teeth as well, or like break down bacteria. Alrighty. Okay, what is the best protocol for a new diabetic? I'm currently on MetaPower system and alternate LLV and VMG. Okay, so best protocol for a new diabetic. That's a great question. So, and yes, absolutely, the MetaPower system is what I would recommend. So how would I use the MetaPower system? Okay, I think that that's probably an even better question. So I would, what I like about the soft gels are going to have the MetaPower blend in them. So I would take MetaPower soft gels in the morning, afternoon, and in the evening. Okay, and I would start there. Then I would add the MetaPower Assist. MetaPower Assist specifically because it's got the berberine and the mulberry extracts in, which are going to help to regulate our glucose. All right. Now, depending on how high the sugars are, depending on how aggressive I want to be, I might just take one with my main meal, or I might take one with lunch and dinner. If you're eating breakfast, lunch, and dinner, and you really need help, you could take it 3 times a day as well. Okay. But what I like about the mulberry leaf and the berberine, when you take it, and ideally you take it a little bit before food, because it's going to act as an agonist to help slow down the absorption of glucose from the intestines into the bloodstream. So it's going to help to reduce that the glucose spike. By doing that, you're decreasing the insulin spike as well, which is going to be beneficial long term. If you're like most people and you're like, I don't have my stuff all together to be able to be like 15 minutes before I'm going to take it, you can take it around the time that you eat. So whether it's right before, as you're eating, after you're eating, around the time that you eat is going to be beneficial. Okay. And consistency is also going to be really important. So as you do that consistently, that's going to help. And I would just look at my glucose levels to see how, is one enough? Do I need to take 2, like one with each meal, like twice, like dinner and lunch and dinner, or do I need to do it for breakfast, lunch, and dinner? Another big thing that I would do if I was a diabetic is I would practice intermittent fasting, knowing that one of the issues we have with diabetes isn't just the high glucose. We focus on glucose because that's what we can measure, okay, in medicine, but it's also the amount of insulin, which responds to how high our glucose is, okay? So knowing that whenever I eat, my body has to release insulin to help me process the glucose, all right? And then, so it gets into the bloodstream, insulin's released. It's then going to do a few things. It's going to send glucose into the muscles where it can be used for energy or stored a little bit, or it's going to be sent to the liver for storage into glycogen, or it can sometimes be like stored throughout the body, okay? So the higher the glucose spike, the higher the insulin spike, if we're not very active, the more that gets stored, okay? And the more it's stored, the more long-term problems we're going to have. So a few things we can do with that. Intermittent fasting is great because it gives our body a little bit of a break for insulin. It allows us to start using up some of that storage. And so it's kind of got like a more regular a turnover, okay? But by giving our body a break from insulin, it also helps our cells to become more sensitive to the insulin so that they respond better. Because a lot of times what happens, we get our glucose spike, insulin secreted, and it's telling our cells, it's like, all right, take up the glucose, and our cells are like, we don't need glucose, we're not doing anything, right? And so they become desensitized, and then more glucose is then stored away in adipose tissue, in the liver, getting fatty liver and other metabolic issues. Okay, so again, berberine and mulberry actually help to move glucose into the cells, which is really beneficial. Another good thing is go for walks after you eat. Okay, so when you've eaten your meal, it's really, really healthy if you can then go for it doesn't have to be a crazy walk, like a 10-minute walk, a mile or so. What's nice about that is it's going to help your body to mobilize things. It's also going to start to use energy. Your muscles are going to be contracting, they're going to be working, and so they're going to need glucose. And so they're going to facilitate that movement of glucose into the cells. It's going to help the cells to stay more sensitive to insulin. So that's going to be really beneficial. And then intermittent fasting is beneficial in terms of that insulin sensitivity, because by giving the muscles those receptors a break, they don't become fatigued and they become more sensitized. So intermittent fasting can be a really, really beneficial thing. Again, it's not for everyone. I 100% appreciate that. But an easy way to start is if you can just go 12 hours between dinner and breakfast. That's an easy one to do. All right. If you have dinner around 7 p.m., have breakfast around 7 a.m. Okay, that's a good 12-hour window. And then you can start to like expand that if you want. Maybe once or twice a week you skip breakfast and you take that fasting period from 7 p.m. all the way to noon. Okay, maybe instead of eating at 7, maybe 7 a.m., maybe we'll push it off to about 9 a.m., giving you 14 hours. There's different ways you can do it, but that can be really beneficial. Another good way to look at managing diabetes is to change what you're eating. Okay, specifically what you're drinking. Okay, try and move away from sodas and drink more water, like sodas and fruit juice. Okay, they're high in sugar, in glucose, but they have very few benefits. And the problem with that is it really makes it so easy for the body to absorb, so you get even bigger spikes in glucose. All right, sodas with high fructose corn syrup are even worse. So I highly recommend try to drink more water. If you need flavor, I love adding essential oils into my water, because it flavors it in a way which isn't gonna affect my glucose metabolism, but it is gonna add different benefits. Okay. Another good way, so fluids is going to be a big one. And then just eating less processed foods and more whole foods. Whole foods, they have more fiber in, more complex glucose. They break down slower, so we don't get such a high spike. Okay. So trying to eat more whole foods, less processed foods is also going to be really good. Okay. Moving on, I have some significant back issues, including bulging discs. What doTERRA products can I use to help support and potentially help heal? I use Deep Blue Rub multiple times a day. Okay, so few products which I really, really like. Okay, so when we're looking at bulging discs, okay, it's a structural problem. All right. You got your vertebrae, which are bones, and then in between the bones, you've got these little vertebral discs, which act as kind of like shock pads. When you have a bulging disc, they've kind of been compressed to the point where now like bulging out. That bulge can cause irritation on the nerves surrounding it. It can irritate the muscles. It puts more stress on it because structurally it's not as sound. Okay, so few things which are going to be really, really beneficial. Healthy lifestyle. Okay, if you can lose a little bit of weight to take the stress off your back, that's going to be really, really beneficial. If you can do some core strengthening exercises. Okay, now I love yoga for that, but you can do a lot of stretching as well. But as you build up your core, it's going to help to support that loss of integrity, and so that's going to help significantly. And then also learning how to lift properly is going to be really, really beneficial, because one of the issues we have with bad backs is it affects how we're moving. It affects our ability to function. So often we end up moving in a compromised state. So strengthening our supporting muscles is going to be good. And that's a lot of reasons why we do physical therapy. Yoga, again, I love doing yoga for a lot of benefits, but especially for back health, yoga is really, really good. Stretching can be beneficial. And then I like to use, you can do internal products from doTERRA and topical products from doTERRA. When I think of internal, I think of like, how do we settle down inflammation? Okay, so when I think anti-inflammatory supplements, we've got Copaiba soft gels, we've got Deep Blue polyphenols, we've got turmeric duo caps, we've got frankincense duo caps. VMG also helps with inflammation as well. Okay, if you're still using Lifelong Vitality, the Alpha CRS Plus would be good. And so you can use one of those, you can use a combination, you can use all of them. It really depends on how bad the pain is. And what I another thing which I like to recommend people is develop your daily regimen for making sure that you've got, like, you're supporting your overall health and wellness. And then as things flare up, or as you need a little bit of extra support, then I start to like take a little bit more. So what I would probably do if I had a bad back, I would definitely take my VMG plus and my omegas just to kind of help support my body as much I can. And then I would probably take Copaiba morning and night, because I'm a big fan of Copaiba and how good it is as an anti-inflammatory. I would probably consider taking frankincense duocap or turmeric duocap. I love both of those, and there's lots of other benefits, but specifically in this case for pain. And then I would kind of like, that would be my daily thing to help support my back, hopefully help heal it. And another great thing you can do would be to take the MetaPower Advantage. That has the collagen in, which is going to help to support connective tissue health. Okay, and there's actually, I forget which collagen strand it is, but there is a collagen strand specifically helping to support the back in the MetaPower Advantage. So that would be something which I would definitely take on a daily basis as well. And then as things are going on in my life, I might add deep blue polyphenol. I might add frankincense, turmeric duocap, depending on where I'm at. I might increase my dose. If I'm just taking one a day, maybe I'll take 2 a day. And that can be, maybe I'm helping someone move. Maybe I was a weekend warrior and I did more, I pushed myself harder and I kind of like flared up my back. That would be when I would take a little bit extra. Okay, hopefully that helps. The amount of berberine in MetaPower Assist seems a lot lower than what gurus recommend. How is Assist different from a regular berberine supplement? Okay, so how is it different? It's not just berberine. Okay, you are right. There is less berberine in MetaPower Assist. Off the top of my head, I couldn't tell you the exact dosage, but it is a little lower. The reason it's a little lower is because you've also got the mulberry leaf extract. You've got the MetaPower blend in there as well, and a few other things. And so it's not just one thing that we're doing to help in terms of glucose metabolism. So you've got some options. Okay, if you're taking MetaPower Assist and it's like, I feel like I need a little bit more, you can take more. Okay, what's interesting is there's also berberine in the Xendocrine complex. So if you're looking at doTERRA sources for berberine, you've got MetaPower Assist and Xendocrine. But again, like, berberine is good, and if you just want berberine, there are other sources. What I like about doTERRA is we know it's coming from a good, clean source that is potent and therapeutic, but it's also combined with other components which are going to really help to support overall metabolism. Okay, so that's why I like using MetaPower Assist and recommend that. Moving on, I recently moved into a renovated place that was previously flooded. Construction dust everywhere, walls, windows, floors, fixtures. Some is cleaned out, but definitely not all. How would you handle cleaning air? What oils, products would help? Clean the air, detox from the symptoms, headache, dust in nose, coughing here and there. Okay, so excellent question. Oh, excuse me, speaking of noses. So how would I clean the air? Ventilation. You've got to ventilate as much as you can to try and allow things to move through. So what I like to do, I would open up all the windows and I would aggressively dust and sweep everything. All right, and try and get everything out. When you do that, it is going to kick up a whole bunch of dust. So the other thing which is going to be really important is wear a mask. Okay, one of the best things you can do is reduce the amount of dust that you're breathing in, and you can do that by wearing a mask. Okay, simple as that. So as you get ready to clean, put a mask on, go ahead and clean. And what I would do is like dust, get everything out, and you might need to do it a couple times. Okay, I like microfiber cleaning cloths because they tend to trap more dirt. So that can be a good one, but it's going to be a lot of hard work. Then once that's done, if I want to clean the air, I love diffusing things like On Guard. I love citrus essential oils as well to kind of help clean and purify the air. Purify is another great one that you can use. So I would do that. But then because a lot of times you do end up with some dust, especially just from time to time, doing a nasal rinse is really, really beneficial. Helping to flush and clean out the sinuses can be really, really beneficial. So there's a bunch of different ones on the market. And you can use whichever one you like. I like Neti Pot. It's just I find that super easy. And what I typically like to do when I use a nasal rinse, I'll add a drop of essential oil into that rinse just to kind of like help magnify the effort. So essential oils that I like to use, Copaiba and lavender, I really like to use to kind of help settle down what's going on. Melaleuca can be a good one. And what I would recommend is, like, again, go small. It's a very sensitive area. So sometimes even one drop can be a little strong for people. So if you've got the little dram bottle where you can just tip it up and do a little tap, you get about a quarter of a drop that way. So you can kind of like, try 1 or 2 taps, give that a go. If it feels good, great. If you want it a little stronger, you can do 2 or 3, 4 little taps on it, or just do a full drop. But you can kind of regulate how much essential oil you're putting in to your neti rinse when you try it. But I really do like using Copaiba. That's probably like one of my favorite ones, especially when I'm doing my spring cleaning out my garage and it gets all dusty. I find that if I'm not wearing a mask, if I don't clean my sinuses, I really start to feel it the next couple of days, and it can cause issues. So that's how I would do it. Okay, ventilate really well, wear a mask, dust, wipe down, and then for the next day or 2 afterwards, do a saline rinse, and that can be like morning and night, however often you like to do it. Okay. What are the best oils to diffuse, or topical or eternal, if someone is very angry? Oh, that is a good question. And you know what? I am interested. We talked about at the beginning, you guys had great suggestions for oils that you gravitate towards when you're like not having a great day. What oils do you like to use when you are angry and you want to kind of like calm down? All right. So maybe not just like today, it was more stressful and a little run down, a little fatigued, and I need a little pick me up. But there's other times when we're just straight up upset, where we're angry with people. We maybe had a fight with a spouse, like maybe things aren't going our way, and we just get into like an argument which we really didn't want to have, and we really want to change how we're feeling. Or maybe someone's just going through a lot and they're just not acting themselves, and you want to try and help support them. What can we grab to kind of use? All right, so let's see. We've got tea tree and Frank. Oh no, that's for the rinse. Yep. Oh, that's a good idea. Frankincense too. I like that. All right, so Gwen's got Serenity. Chrissy's got Forgive and Balance. Oh yeah, Forgive's a good one. Amy, Peace, Console, Cardamom. Faith also likes Adaptive on the pulse points. Amy likes Time. Kamini likes Peace and Balance. And then Lane Adams likes to use Serenity a lot. Okay. And I feel like this is something where it's fun to experiment, right? It's really fun to experiment. If you've got teenagers in the house and they're like bickering and arguing, sometimes it's fun just to get out a diffuser and try and mix something up. All right. And it can be kind of fun just to kind of see how it goes. Sometimes it's really good to get it on the people. Okay. So one of this was probably, I'll let you into a little secret. Ruth and I do have fights from time to time. And I remember coming home from work one day, and I was worn out, I was tired, and I don't even know what we started fighting about. Okay. And I'm sure a lot of you appreciate that. You find yourselves fighting and you don't even know why. But I do remember having this overwhelming feeling of like, I haven't seen my wife for a while. I love her. I don't know why I'm fighting with her, and I don't know how to fix this situation. But I do remember just expressing that sentiment to her and being like, honey, like, I love you. Like, and I don't want to fight with you. I don't know why we're fighting right now. Can we do something different? You know, can we do something else? And what amazed me was it completely diffused the tension, right? And I think it diffused the tension for a few reasons. A lot of times when we get angry, we get defensive and we start like defending ourselves. We start not listening to the other person, and it's almost like us against them. All right. And we forget that we love that individual. And so I thought it was, when I look back at it, that interaction we had, I'm like, you know what? For me, what was important was number one, expressing love, right? Reminding myself and also my wife that like, I love you. And then just being straight up like, I don't want, let's do something else. And I remember we did sit down. I gave her a little hand rub. And why a hand rub like technique? It wasn't because I was like, you need some oils. It was like, I want to do something nice for you. I want to do something that lets you know I care about you. And I could do with the calming sensation too. Now, what I love about Ruth, balance. I know that that's one of her favorite essential oils. If I want to do something nice to her, I can get balance out and do a hand technique or whatever. But I would recommend, if someone is very angry, if you can, sit down with them. Sit down and do a little hand technique. There is something therapeutic about touch, especially loving, kind touch. Um, and in terms of like the essential oil, like let's just do a quick check. So we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I think we've got 10 different oils. 10 different oils that you guys have recommended. Sometimes it does, you know, these, I think it doesn't matter which essential oil you use, there's going to be some benefit. Some people gravitate towards others. I like Bonnie's. She's got the ABCs of calm: adaptive, balance, copaiba, and serenity. That's funny. ABCs, I like that. Maybe we can add Shinrin Yoku to the S as well. ABCs. But grab an essential oil and just try. Okay. It's another great time to be like, if you've got essential oils at home and you just want to experiment like with your loved one, with your friends, just smell an essential oil and be like, which one do you like? All right. If you know what essential oils people like, that can be a good essential oil to grab, right? When they're feeling angry, they're feeling overwhelmed, and you want to do something nice to them. Um, and sometimes it can be a fun, like if they're open to an experience, get out an essential oil, have them inhale it, and just ask them, like, how does that make you feel? Right? Sometimes it will be like, oh, I don't like that. Okay. Sometimes it'll be like, oh, I like that smell. That helps me feel da 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 da. And then just kind of lock that away and be like, okay, I'm going to use this when I need that. It might be that helps me to focus, that helps me to relax, that helps me to calm down, like helps me, you know, whatever. So that's what I would say. I would say you can diffuse and be passive. You can also be a little more active and like sit the individual down. I love sitting people down and like being with them because you get to be with them, you get to touch them, you get to interact, and it's a really good way to let people know that you are there for them and that you care and that you're listening just by doing that. I think a lot of you know the story about like how Lily and I really didn't get along when she was young. She was on the spectrum. I would get home from work, I was tired, I was fatigued. Residency was not a great thing to go through. Um, and we were struggling with Lily, and our relationship was really struggling. And when doTERRA came into our life, my wife was like, why don't you just massage Serenity on her feet to help her settle down, instead of like having it be such a conflict when you try to put her to bed. And doing that like completely changed our relationship, because again, like that touch was connected. The Serenity helped to calm Lily so that she settled down, she could sleep, helped me to settle down, I was able to rest. And as we did it, we were able to have like a solid time where it was just us connecting physically, emotionally. Like it that was one of my favorite memories of doTERRA when we first started using it. And it's why I will always advocate using essential oils as part of touch. Would Intune help? Give it a go. I don't think it's not going to help. I think the only essential oil which would make the situation worse is if you threw oregano at them. Okay, don't go throwing oregano or pink pepper in their eyes. That would not help the situation. Okay. But yeah. Oh, and then Bonnie, the ABC roller has diverted our autistic twins when they are overwhelmed. Yeah, I love it. I love it. Someone's asking how many drops. So here's what I like about rollers. You get to control. All right. An easy thing which I tell people to do when you get a roller ball, start with 10 drops in, and then fill it halfway up with fractionated coconut oil. So ABCs, Adaptive Balance, Copaiba, Serenity. You could put 10 drops each in a little roller ball, fill it halfway up, and start using that. If that's a great mix, then you can just add another 10 drops each and fill it all the way up. If it's a little strong and they're like, oh, I don't quite like that, then you can just fill it up with more fractionated coconut oil and dilute it a little bit. Okay. But again, like experiment and have fun with it. I think the funnest thing when it comes to essential oils is as we get a little collection, it's an opportunity to experiment. So try something new. Okay. And as you do, I think you're going to be amazed at just how useful these essential oils can be and how empowering it is to have these tools at our fingertips in our home, so that when something happens, we can do something productive. Okay. Whether it's I get home from a shift and I'm not feeling great. And instead of like feeling bad, I want to change my mood. I can grab some essential oils and I can oil up. Maybe it's a loved one who's having a hard time and I don't know how to help them. I can put a diffuser out, or I can just say, hey, can we just have 5 minutes? Like, tell me about your day and let me do this while we talk. Maybe it's someone who needs some metabolic help, and then we can take things internally. Like there's so many things we can try and start having an impact to influence our health and wellness on a daily basis, which I absolutely love. Okay, so Bonnie did give her mix. She likes 15 to 20 drops each with fractionated coconut oil on for her ABC roller to help when her twins are overwhelmed. All right, guys, I hope that was helpful and beneficial. I've enjoyed the interaction. Thank you so much for joining me today and for making this a little bit more of a discussion. I really do appreciate the questions and also the answers. So thank you very much. Melody has posted a link where you can find a recording and resources, as well as our education library, which you have, if you're part of Heights, you have access to that. Go for it. If not, you can join Heights and then get access to that as well. So thank you very much, guys. We look forward to seeing you on Monday at 7 p.m. Okay, take care, guys, and we'll see you then.